Hello, guys. Hey, my name is Mykesha Evans, and today my presentation is going to be about private versus public health care in the U.S., Australia, and Switzerland. So let me get down to it. In each country, the healthcare system has its own set of rules and regulations concerning the health of their citizens, right? So the policy that relates to the topic and video of choice is the healthcare reform. The healthcare reform means better care for everyone. I know that seems simple, which I know we all want better healthcare, but it's a lot that goes into it. And it examines available insurance options for those who did not have access to it before. And it also make it affordable depending on the person's income stability. So I want to talk about more about um, the healthcare reform, as I was just saying, and public and private healthcare among the U.S., Australia, and Switzerland. But first, I want to talk about the Commonwealth Fund. If you don't know about the Commonwealth Fund, it is a private U.S. foundation that promotes a healthcare system for better substantial living in society. And it was specifically for people who are vulnerable or elderly. And I also want to talk about the top five of the Commonwealth Fund. So number one is access to care, meaning it determines the affordability of how much a person wants to spend for healthcare coverage. Each healthcare coverage varies. And number two is care process, means that it determines the quality of medical services between the patient and physician, meaning that making sure that whatever healthcare facility that you go to, making sure that it treats you for all your needs and visits as well. Number three is administrative efficiency. Number four is equity, meaning it discuss the different level of income groups. And last but not least, number five is health outcomes, meaning how effective the healthcare benefits have treated for the individual. Was it good or was it not good? Just basically providing feedback. So I want to talk about the USA, my home country. And I also have a flag, so woo, go USA. All right. So the US does not have a universal health insurance coverage. So nearly about 92% of the population was estimated to have coverage in 2018, leaving 27.5 million people or 8.5% of the population uninsured. So the movement towards securing the right to healthcare has been incremental. The public insurance programs, which are Medicare and Medicaid, that falls under Social Security Act, it ensures a universal right to healthcare for people who are ages 65 and older. And eligible populations and the range of benefits covered have gradually expanded miraculously. Medicare can even cover drug prescriptions from private healthcare providers, so that's pretty good. And the Medicaid program first gave states the option to receive federal matching funding for providing healthcare services to low income families, people who are blind, and people who have disabilities. So today, Medicaid covers 17.9% of Americans, as it is a state administered means tested program eligibility criteria that varies by state. And the Affordable Care Act, which we call it the ACA Act, represent the largest expansion to date of the government's role in financing and regulating healthcare. So that's the USA. And for the strengths, I said From that, it has equal access to health care, improve public health, it stops medical bankruptcy, and encourage entrepreneurship. And for my weaknesses to that, I said it reduces competition and innovation. It leads to a more socialism state and rationing due to medical abuse. So that's USA. And our next thing we're going to talk about is next country, Australia. Australia. All right, so Australia's healthcare system is recognized as one of the best in the organization for economic cooperation and development. However, it has come under intense pressure due to changes in healthcare needs, such as increase in demand and healthcare costs, inequities, complex health conditions, and a push to improve the outcomes. The Universal Public Health Insurance Program, which is Medicare, is financed through general tax revenue and a government tax. The private system includes health service providers that are owned and managed privately, such as private hospitals, specialist medical and allied health, and pharmacies. The cost of seeking health care from a private hospital can be a barrier for those who do not have private insurance and are not able to afford the cost from their own funds. And my strengths to that is the Australian Medicare is a tax funded public insurance program that is free for all that includes like physician and hospital facilities and part of the cost of prescriptions. So that's awesome. And for my weaknesses to that is that Australian healthcare system has a very long waiting list for many hospital medical procedures. And also there are problems and difficulties with health workforce supply and distribution in Australia. Yeah, so that's Australia. So our last country that I'm gonna talk about is Switzerland. Switzerland. All right, so Switzerland have access to a universal basic plan, meaning the law requires that all individuals purchase health insurance from a private insurer. Insurers must charge all people the same price for a given health plan. Individuals who cannot afford the premium even for a basic health plan receive tax finance subsidies from their cantons. Public finance health care accounts for 62.8% of health spending, 7.7% of GDP. And for private insurance, residents are voluntary health coverage to pay for services not covered by mandatory health insurance and to ensure free choice of hospitals or doctors and preferred hospital accommodations. Yes, and it talks more about them having the basic package of services. I believe that's all the citizens that have, or I guess more affordable costs. And for the strengths that I said for Switzerland's healthcare plan, is the coverage is provided by competing private insurance companies. Residents pay premiums up to 8% of their income. So that's great. Weaknesses is increases government debt, medical abuse leads to dispensing, and also long wait times. So that's that. So my recommendations for change that needs to happen is to improve or make changes to a better healthcare system for America and other countries to improve equality, well, quality, safety, and save money. And what social workers can do to promote these changes is that they can do research and understand the importance of public and private health care for all recipients who need health care coverage. Social workers should also communicate with policymakers to come up with reasonable law that mandates a better quality of life for recipients. Others can do their part by making their voices be heard and demand human rights that they deserve. Thanks for watching, and I hope you guys enjoyed this video and learned something very positive. Bye.